Aisha is a fictional character, but what they went through is happening across Yorkshire and the Humber today. This is their story. In one of the most deprived constituencies in England, qualified healthcare workers are blocked from specialist training while children with diabetes wait months for care that trained nurses could provide. The training places exist, the people exist, but Treasury spending limits keep them apart. This is Aisha's journey through a system that confuses political choices with financial impossibility.
My name is Aisha. I'm 28 and I live in Page Hall, Sheffield, where my parents have run a small grocery shop since they arrived from Somalia in the 1990s. I grew up watching my mum stock shelves with one hand and test my younger brother Yusuf's blood sugar with the other. He was diagnosed with type 1 diabetes when he was 7, and I learnt to calculate carbohydrates before I learned algebra. The community nurses who came to teach our family about insulin management were the first people who made healthcare feel like something I could do, not just something that happened to us. I was good at science at school, especially biology. During sixth form, I volunteered at a local care home and knew I wanted to be a nurse. Not just any nurse, I wanted to work with families like mine, helping them navigate diabetes care, making sure no parent ever felt as lost as mine did in those first weeks after Yusuf's diagnosis. In 2014, fresh from my A-levels with grades good enough for any university, I applied for nursing training at Sheffield University. That's when I first heard the phrase that would follow me for years: there is no funding. The admissions tutor was apologetic but clear. Health Education England had reduced the number of funded nursing places. Despite my grades, despite the obvious need for nurses in Sheffield, despite everything, there simply wasn't a place for me that year. I didn't accept defeat. I got a job as a healthcare assistant at Sheffield Teaching Hospitals NHS Foundation Trust, thinking I'd prove my commitment and reapply next year. The ward I worked on was understaffed. We all knew it, the patients knew it, their families knew it. Yet when I applied again in 2015, I was told the same thing. The budget has been cut. Health Education England had funding for fewer training places than the previous year. Finally, in 2016, I was accepted. But by then, the government had scrapped the NHS bursary that would have covered my living costs. I took out additional student loans, telling myself it would be worth it once I was qualified and working in the NHS. The irony wasn't lost on me. They said there was no money to train me, but somehow there was money for me to borrow. I qualified in 2019 and immediately applied for specialist diabetes nursing training. This was what I'd been working toward for 5 years, the chance to become the kind of nurse who had helped my family. NHS England's response was familiar. There is no funding for additional specialist training places in Yorkshire and the Humber. They suggested I could apply for general positions and perhaps specialise later when budgets allowed. In 2021, I tried a different approach. Sheffield Children's NHS Foundation Trust ran their own diabetes nursing programme. I applied directly, thinking I could bypass the regional funding constraints. The training coordinator was enthusiastic about my application, my experience, my clear commitment to diabetes care. Then she called me back a week later. The training budget has been frozen by Treasury spending limits, she said. We cannot afford to run that programme this year. I accepted this explanation at first. It sounded reasonable. Budgets are tight. Money doesn't grow on trees. We all have to make sacrifices. Everyone accepts this logic because it sounds like common sense. Then I saw the Diabetes Education Centre at Northern General Hospital. I was visiting Yusuf there for his annual review when I noticed a whole floor of empty training rooms, modern equipment sitting unused, simulation mannequins still in plastic wrapping, teaching material stacked in boxes. I asked one of the staff nurses about it. "Oh, that's our training centre," she said. "We've got 12 places approved for diabetes nurse training, but Health Education England can't release the funds. Been like that for 18 months now." She paused, then added, "Funny thing is, we've got over 200 diabetic children on our waiting list. Some of them wait 6 months just for their first appointment with a specialist nurse." That's when it stopped making sense. The people existed. I was one of them, and there were others like me. The training places existed, 12 of them sitting empty with all the equipment ready. The need existed, 200 children waiting for care that trained nurses could provide. The building existed, the teachers existed, the curriculum existed. What exactly was it that there was no money for? The government that issues the pound, that prints every note in my wallet, told me it could not find enough of them to connect willing people to necessary work. The real question was never about money. It was about whether the people existed, whether the skills could be taught, whether the equipment was available. They were. All of them. I used to accept the excuse that there was no money. I hear it differently now. The government that prints the notes and mints the coins told me it could not find enough of them to train the people who were standing right there, ready to work. The excuse was not a fact. It was a choice wrapped in the language of impossibility. It is the same logic as a household that says we cannot afford it, except a household does not issue its own currency. The government does. The limit was never the money. The limit was the willingness to spend it into the places and the people who needed it. I still work as a general nurse at Sheffield teaching hospitals. I still see diabetic children and their families struggling with the same confusion mine faced years ago. I still watch empty training rooms while colleagues burn out from understaffing. But I no longer believe the story about empty cupboards. I understand now that what happened to me is happening across every constituency, where people and needs exist side by side, while someone in Westminster says the money has run out. The resources are there. The choice not to use them is political, not financial.
What Aisha experienced has a name: fake experts. Throughout history, industries have used supposed experts to manufacture doubt about inconvenient truths. Tobacco companies funded scientists to question smoking research. Pharmaceutical companies paid researchers to downplay addiction risks. The technique works by finding credentialed voices who will repeat the desired message, then treating their opinion as settled science. In Aisha's story, every time she was told there is no money, officials cited economists or budget analysts who treated the household budget analogy as self-evident truth. They pointed to Treasury advisors who insisted government spending must be constrained like family finances, as though repetition made it reality. But the UK government issues its own currency. Unlike a household, it does not need to find pounds before it spends them. Many macroeconomists understand this, but their voices are drowned out by those who profit from the scarcity myth. When challenged about healthcare underfunding, defenders often claim, economists say we cannot spend more on health without causing inflation. Which economists? The profession is divided. Many argue the binding constraint is real capacity, not currency. Economists say, without naming them, is an appeal to unnamed authority. The resources existed, the people existed. The decision not to connect them was political, not financial. Sheffield Brightside and Hillsborough ranks 12 out of 543 English constituencies in the English Indices of Deprivation 2025 from MHCLG, placing it in deprivation decile 1. The constituency has 110 registered charities according to the Charity Commission Register for England and Wales. Organisations in the area received £860,000 in total grants according to 360 Giving Grant Nav. All sources are published at blockedbritain.co.uk. Blocked Britain tells the stories of people whose lives are shaped by the gap between what Britain needs and what its institutions choose to provide. Every character is fictional. Every situation is drawn from official statistics, produced by Blocked Britain.